shifting to the middle phase of treatment, which is where the nitty-gritty skills-based work happens. So we are going to spend the rest of today on the middle phase and tomorrow morning as well, the bulk of tomorrow on the middle phase. So please come back tomorrow because there's more to the story than today. Whoops. All right, middle phase sessions. I think I've talked about this periodically so far today, but I just want to reiterate that even in the middle phase and in the termination phase, we begin each session with a brief review of their depression symptoms and the mood rating. So, Tara comes in and I say, "So Tara, how's the past week been?" And I give her a few minutes to give me a little synopsis of what may have happened this past week. That's important because I get a sense of, do I have an impending crisis session? Has something gone bad? And I may end up having to assess whether there's a crisis. And it gives me a little hint about, is there something else that I want to talk about with her after I review her symptoms? So I give her about 5 minutes to give me a little update on the week, and then I say, well, that may be something we want to come back to, but before we talk about that, I want to check in on your symptoms. How's your sleep been? How's your appetite been? How are you doing in school? Has your concentration improved? Are you doing your homework? I want to check in on her mood rating. How's your mood been this past week? Let's go back to our mood scale. On a scale of 1 to 10, what's been your average mood rating for this past week? What's been your best? What's been your worst? And then I, again, talk to her, when was your best mood? What was going on then? When was your worst mood? So I have an idea of what's affecting her mood in this past week. That's how the beginning of every session goes throughout the rest of treatment. In the middle phase, you're really beginning your collaborative work with the teenager to identify what you need to be focusing on to make that problem area improve. You're working on the communication strategies, you're working on problem-solving strategies, whether they need to learn how to have a little more empathy and perspective-taking in their situation, what kind of skills they need to better be able to negotiate their relationships. This is the crux of the middle phase work. So your tasks as a therapist are to monitor the depression symptoms, as I just talked about. You're going to try and help the adolescent be able to talk about the problem area. You want to ask open-ended questions to try and facilitate their self-disclosure about their emotions and problems that they're having. Let's not forget that they go to school. In the middle phase, you may be needing to contact school to check in on how they're doing, to corroborate the adolescent's view of their schoolwork. I've been fooled too many times by the teenager who says, "I'm doing so much better in school." Not really true. You sort of have to verify that for yourself sometimes. And check in on whether the parents are still in support of therapy. You don't need to bring them in for a therapy session, but depending on that family, if you feel like the parents' buy-in to treatment is tenuous, you might do a check-in phone call. Just want to say we're continuing to work hard in therapy. Thank you for making sure your teen can get there. You want to keep that alliance going with the parent because they can easily come up with things that will interfere with their teenager getting to therapy. So while you're not having them attend the therapy sessions, you want to make sure they're still in support of the adolescent attending. And it's your job to keep the adolescent focused on the identified problem area. So we all know adolescence, there's the flavor of the day, there's the problem of the week, and it's important. That's why that first 5 minutes gives them a chance to talk about the problem of the day and gives you a chance to assess whether you need to shift your focus from that identified problem area to something else, or is this just a temporary little annoyance that you can deal with quickly and then get back to the bigger issue that's more related to their depression. Parental involvement, we've talked about in various times this morning. In the middle phase, the involvement is as needed. It's negotiated between the therapist and the adolescent. So as we said before, there are some cases where the parents do not come back in the middle phase. They don't come back until the end of treatment, where you're meeting with them to review the course of treatment. We talked a little bit about the kids who say, it's not me who really needs to be here, it's my parent who has the problem. And I like to give them the metaphor that it takes two to tango. Yes, you may feel your parent has the problem, but there's something that you're doing within your parent's difficulty that's creating more of a problem, and it's a problem for you as well. So you're both doing the dance, you're both contributing to this problem, so you can also help the problem by being the one in therapy, and the goal will be to help your parent change as well. It's very important to assess your adolescent parents' functioning and how open they will be to making changes in their communication as a result of the adolescent's changes. Sometimes you'll hear the kids say, my parent is never going to change, they're not going to be receptive. And sometimes as therapists, we need to meet with the parents individually to do our own assessment of that, to see whether we're up against a situation that isn't very malleable, and also to kind of grease the wheels for the adolescent and do a little more psychoeducation with that parent to help them be more open and to help coach the parent on their own communication and problem-solving skills, so it'll be a little bit easier for the child to do that. So it isn't unusual sometimes in these more difficult cases to bring the parent in to meet with you alone to do that session. Part of the process for you is deciding whether, one, does the work with the parent need to be done individually? Is this parent too toxic that if you bring this parent in with the adolescent, it's going to be a bad experience? You're not going to be able to control this parent from being very negative and nasty and condescending to the adolescent, so that it's not a good idea to do a dyadic session. The other and less optimistic outcome of meeting with the parent is that we decide that this relationship isn't going to be very viable for improvement, and so our work with the adolescent needs to be finding somebody else to be their support system, to find another relationship that they can get what they're looking for, that looking for a certain kind of nurturance and support from this parent isn't really going to be possible because that parent may be too ill and is incapable of it. So we have to work with the adolescent to revise their expectations for that relationship and see if there's somebody else whom they can expect those things from, who they can develop a different and more supportive relationship with, who they've had in their life, but they haven't cultivated that relationship in the same way. That's our less desirable outcome for a treatment, but one that happens with certain kids who are in families that are highly dysfunctional. So the cartoon says, so did anything interesting happen today, Jeremy? Dude, and the kid doesn't say anything. Dude, it's about time you called me back. Wait till you hear what happened today. And then he turns to the father and says, nothing happened today. So clearly, in this cartoon, we need to work on improving the communication. How can this father have a relationship with this adolescent where the teenager will feel like he can tell the father what happened rather than just shutting him out and only talking to the friend? While some of that's developmentally appropriate, you still want to have the adolescent being able to share something with their parent. Clarification of the problem in the middle phase is a lot of the work is continuing to hone in with the adolescent on what they want to change specifically in that relationship. And in order to figure that out, it's very important to talk with the adolescent about what they've already tried and what the outcome has been. The reason for that is you don't want to recommend something to them that they've already tried, because that could be pretty irritating for them. But the important thing to learn from asking for these examples is it may be that they're close to figuring out what the right thing to do is, and you just need to tweak it a little bit, which will be a much easier thing to do than if you have to shift and try something completely different. So it's really important to see what they've already done, how you can tweak it to make it work better. And if that's not possible, to work with them to discuss what the other options are for solving this difficulty in the relationship. So as we talked about, our sessions typically begin, have you been since we last met? And again, one of the main focuses of treatment throughout all the phases is helping the adolescent to make that link between their mood and things that are going on in the relationships. And sometimes we have teens that come in and they're really able to talk about their feelings. I felt bad, it was a terrible week. And then you ask them, well, what happened this week? And they say nothing. So for those adolescents, I find it's very helpful to start very systematically going through the day. So, you know, you said Wednesday was the day that you felt worse, but you can't figure out what happened that day. So let's take that day. So you got up for school that day. Who woke you up this morning? How did you wake up? Were you in a bad mood by the time that you came down for breakfast? Did mom wake you up by throwing cold water on your face? You know, you can start to systematically go through the day like that, and very often you'll find out what it was that happened that contributed to their mood, and then you can educate them. Well, see, you know, as we began to talk in detail about that day, it sounds like it started off on the wrong foot when mom woke you up in a way that really set you on a bad path, and then she started picking on you at breakfast about the fact that you were running late and she was going to have to take you to school, and that was going to set her day off badly. And so the irritability began to build already at breakfast. And so you can start to educate them as to the link between their mood and the things that have happened during the day. We also get teens that come in and say, I had a huge blow up with my mom, and then you ask them how they feel, and they say, I don't care, it doesn't mean anything to me. And so for those kids, we're trying to help them learn to label their emotions. And the way that we do that is sort of helping them see what their behavior is. What do you mean you didn't care? So after you and mom had that big fight, what did you do? Well, I went into my room and I slammed the door and I began to hit my head against the wall. Wow, that sounds like, you know, you had a pretty big reaction to that fight with mom. What do you think people, you know, maybe you weren't feeling this way, but what do other kids, if somebody told you they had done that, what would you think they had been feeling when they punched a wall and hit their head against the wall? Well, you know, I think they would be pretty angry. So it sounds like you were feeling pretty angry too. I wonder, when you feel angry, do you also feel sad? Do you feel depressed? And so you start to help them begin to put labels on their feelings that they've usually not done, but more looked at their own behavior without associating it with a different emotion. So it's a really important goal of the middle phase to help these kids make that link between my emotions and things that are happening in my relationships and the behaviors that I think I'm engaging in and what those represent in terms of my feelings. So now we're going to shift to problem area specific strategies. So the grief problem area, to remind everybody, is when you've suffered a loss that's a result of an actual death of somebody who was important to you. And I want to put a caveat out there that I think what we do using interpersonal psychotherapy for the grief problem area isn't radically different from what good grief counseling is. I think that we may, again, review the relationship with the deceased in a little more detail than you might in general grief counseling, but I assume that a lot of these strategies will sound familiar to you. So first and foremost, we educate the adolescents about the mourning process to help them understand what it is that they're grappling with and why they may be feeling depressed. And we feel that it's very important to review the lost relationship in great detail. So for an adolescent that I treated whose mother had died of stomach cancer but had not been diagnosed till quite far along, one of the things we started out with was, when did she learn that her mother had cancer? How did she learn it? Who told it to her? And how did she feel when that happened? And then how did that influence her relationship with her mother over the next several months, where her mother was in and out of the hospital until she passed away? And that was a very powerful exercise, because when that adolescent originally came in and started talking about her mom in the initial phase, she said that she had the best mom in the whole world, and that's why this was such a terrible loss for her, because her mom had just been the greatest. But as we began to talk about the events surrounding the death, it turned out that mom hadn't been, mom was pretty good, but mom had some faults and there had been some problems. Mom was a single parent and had a lot of male visitors in and out of the apartment, often making this adolescent give up her room. But the bigger issue for the adolescent had been, while mom knew she was dying, she hadn't made a very good plan for who was going to take care of the adolescent. This girl had 2 half-siblings who were in their early 20s, one of whom she had pretty much no contact with, and a sister who lived locally. And mom had made a plan for her to move in with her sister, who was only 22 and still finding herself, and they had not had a close relationship. And what had happened, by the time she came for treatment, she had already been thrown out of her sister's apartment and was living with a friend of mom's on the sofa, but really sort of without anybody who was taking care of her and taking responsibility for her. So as we began to talk about the conversations that she and mom had had as mom was sick and making plans for her care, she was really angry about the failure for mom to come up with a better plan, and also to protect and preserve her finances for this child. So in fact, her half-siblings had spent all the money that mom had saved for her support. So it was a terrible situation, and by giving her this chance to do a very detailed review of her illness and the death and what happened after the death, she was able to have a place to start to talk about this. Another thing that we do in the grief problem area is we want to help the kids feel that they can talk to others about their feelings. I had another young male patient whose terrible story, whose younger sister had gotten run over by a bus by accident. And the mother was grieving terribly, and he was grieving terribly, but he felt that he couldn't share his feelings with mom because he was worried that she was already so upset. How would she handle the fact that he was having a lot of guilt, that now she only had 2 boys and she had lost her daughter, and what that was going to mean to not have a girl but to be stuck with 2 sons. And what we sort of got them to be able to talk, and for mom to be able to say to him, I am grieving, but I still want to hear what it's been like for you, and I want you to be able to come and talk to me. So these are all important aspects of the grief work. And then lastly, your goal with an adolescent who may be suffering from grief is to figure out if they've withdrawn from their social activities as a result, to try and figure out how to get themselves back into their activities. With another patient whose brother had died tragically in an accident in the city when the boy had been with him, to talk to him about, does he think that his brother would want him never to go outside and play with their friends again because he had died? Is that the goal that his brother would want for him, or is there another way that he can keep the memory of his brother alive while beginning to get back to his life with his friends since he was just a young teenager? In role disputes, again, our strategies are to relate the depression symptoms to the overt or covert dispute, whatever the conflict is. A very important aspect of working in the dispute problem area is to explore the expectations that the 2 people have for each other, the expectations the adolescent may have for this relationship. Are they realistic? Are they unrealistic? Sometimes our teens, as I said, have unrealistic expectations, and they're going to be continually disappointed unless they can figure out how to revise them and find some compromise point in their relationship. We want to look at how they communicate with that other person, do they need better communication skills to be able to negotiate this compromise. And I like to emphasize to the adolescents that learning the art of negotiation isn't only important just for this relationship, but it's really a skill that will be important for them in all aspects of their life. And talking about jobs and in school, you always have to negotiate in many different situations. So one of the things that's important as you're working within these different problem areas and working on these specific strategies is to help them understand that they will generalize to other situations. These are strategies that apply to a multitude of relationships and situations. In role transitions, when we're working with adolescents in this area, it's important to understand what the change means to the adolescent. What has been difficult about making this transition? What do they find difficult in this new situation? So sometimes many of our transitions are step parents and learning to negotiate that there's another parent in the house. That can be difficult for a variety of reasons. One, less attention from them with their biological parent, that they may have been enjoying a more exclusive relationship with that parent until the remarriage. And the other difficulty with many of these kids is that they don't know how to take discipline from the step parent, and having a lot of conflicting views about how much that step parent should be able to tell them what to do, and how much time and attention is being paid to them versus perhaps there's a new sibling that's come about from this new relationship. So it's very important to explore these situations in great detail to figure out what it is that's problematic in the new situation and what they're missing from the old situation. Because a lot of what we want to help the kids think about is, are there things from the old situation that they're missing that they in fact can bring to the new situation? They just haven't figured out how to do that. So for a parent who, thank you. For a parent they haven't been able to spend as much time with after the remarriage, is there a way to communicate that to their biological parents so they in fact can explicitly say, I really miss the fact that you and I used to go bike riding on the weekends before you married Sue and she had her boys. Is there any way that sometimes you and I can still do things by ourselves? Something as simple as that. Oftentimes these kids haven't communicated anything like that. They've kept it all inside. So when you think about some of the things that might be helpful to these kids to ease their transition, to change the circumstances of their new situation so it'll be more tolerable and pleasurable to them, you need to think about what are the skills that they need in order to do it. Is it social skills? If it's sometimes transitioning from middle school to high school and the kids don't know quite how to negotiate the increased emphasis on dating and changes in relationships with members of the opposite sex. What kinds of social skills? Or the fact that there's mean girls in high school, and how do you negotiate mean girls, and how do you figure out who's somebody you want to trust and who do you not tell your secrets to, and how do you protect yourself from being the latest exclusive on Facebook? These are all the things that these teens are grappling with, and it takes another set of skills to negotiate those new types of relationships. So these are the things that you can work with the adolescent on the problem area of role transitions. Another aspect of transitions is sometimes it's not the adolescent who's having the trouble with the transition, it's the parent. So sometimes we see that the parents are having a hard time accepting that their child is getting older, is moving from an early adolescent to late adolescent, and that requires different parenting skills. It requires acknowledging that Susie isn't going to want to go to grandma's for Sunday brunch necessarily every weekend, but would rather sleep till noon and then go out with her friends. Is that so terrible? It's not really so terrible if mom can have an understanding of that's normal adolescence, separating from your parents, being more focused on your peers, liking to sleep really late on weekends, and it's not necessarily the kid saying, I hate your guts, I don't want to be your kid anymore. So helping the parents understand, what is normal adolescent behavior? What should I be worried about? What shouldn't I be worried about? Picking their battles. What should they be fighting this kid on? You can't fight on everything, about everything, as the kids move to be less focused on you and more focused on their friends. So in those situations, that's another instance where we may meet and have an individual parent session in the middle phase to sort of provide them with some of that psychoeducation about what it means to parent a later adolescent versus a younger adolescent. Interpersonal deficits. As we've talked about, this is really the problem area in which kids are socially isolated and will have a paucity of relationships for us to work on and to problem solve about. So the goal and strategies that we work on is how to figure out how to create more relationships for this adolescent. And so because oftentimes there aren't very many current relationships, we have to review in great detail their relationships that they may have had before they got depressed and withdrawn. So this is one of the few instances where you may do more review of relationships that have been in the past than the present, because these kids don't have very much going on in the present. And again, the same as you did in your inventory review, you want to be looking for strengths in some of these relationships, as well as some of the weaknesses that they may have displayed in these relationships, because you want to be building up their confidence so that they can feel like they can go out and establish some new relationships. So in working with kids with interpersonal deficits, a lot of times we're doing what looks like a lot of basic social skills work. How do you identify somebody that you want to be friends with? What do you look for in a person? How do you know that that might be somebody you think you can trust? So now that you've identified somebody that you want to be friends with, how do you initiate that friendship? How do you sit down in the cafeteria at a table where the kid is sitting that you want to become friends with? How do you join the conversation? Once you start to establish a friendship, how are you going to deepen it? How do you get to the point where you feel you can say to the kid, do you want to get together outside of school, right? Do you want to get together on a weekend? What does that look like? At what point do you start to self-disclose personal information about yourself? We had a bunch of patients at one point who felt that, it was not a big deal to start talking a little bit early about their sexual activity with their new friends. And, one of the things, and then they didn't like the fact that they got reputations around the school. And so one of the things to learn is, you can't go around talking about all that to everybody, because not everybody is trustworthy. And how do you pace yourself in your level of self-disclosure about your family or personal things about yourself, or that you're depressed? How do you pace that? That isn't something you necessarily want to shout out in the first few weeks of being friends with somebody. So in this problem area, we do a lot of rehearsal of social skills in the session, giving them the chance to practice with the therapist before we ask them to go and try these things with a particular person in between sessions. So this is the problem area in which the therapeutic relationship is used most significantly for the practice of skills with the adolescent. And we haven't talked about today, but I know it's an issue, in the communities in which you work. But there's a lot of cultural customs about negotiating parent-child relationships, expectations for your relationship with your adolescent, and vice versa. And we have similar issues in the Washington Heights community as well. And I want to emphasize that when you're working within the IPT framework, you can easily work within the cultural framework of your client as well, because what I like to emphasize is that with the parents is I'm not looking to have your adolescent speak to you in the way that another American teenager might, which may be perceived as completely disrespectful and unacceptable. But what I am looking for is to sort of tweak the way that you are communicating, because the way that it's working now isn't having positive effects on you, your child, or the family. So that let's see what we can do within the framework. Yes, it's very important for your adolescent to respect you, but there's ways that you can open up communication within that same framework of respect that might help the two of you to have a closer and better relationship and a better understanding, so that they don't feel that they have to go underground. Because if you have such an authoritarian relationship with the adolescent that they feel they can't say anything, that's when they get into trouble, as Jamie said. So you want to work with these, whatever cultural group that you're working with that may have that more authoritarian, respectful parenting orientation, and sort of wiggle with it enough so that they can feel that you can show that the adolescent, even if they can talk to them a little bit more and feel like the parent can hear a little bit, they'll be less likely to get into trouble. It's the same way I often, talk to parents about, well, they don't want their kid to do anything. They can't go out after school, they can't date, they can't go places on their own. And one of the important lessons for these parents is learn, well, who would you want them to learn how to do this from? If they can't come to you and get advice about how to start to develop their autonomy, then they're going to get advice from somebody who may not be so great, and they're going to get into more trouble. So given your desire to have them make good choices, now is the time to open up the communication so that you can start to teach them what good choices would mean to you, and to open up that dialogue so they'll understand why those are the choices that you want them to make, instead of just saying, that's it, you have to do it this way or no other way. So I think it's very important to realize that the role disputes problem area and the transitions problem area, they all easily accommodate working with difficulties that we see oftentimes in Washington Heights in terms of assimilation, that the kids are born in the United States and the parents are born elsewhere, and the kids are readily excited about taking on the new American customs of youth that the parents are less excited about, and how to negotiate that cultural divide, and how to clarify and understand their parents' perspective and why they may be setting the rules they may be doing, what the concerns are, and how can they address those concerns while still getting to do some of the things that some of their more American friends are able to do. So it's important to realize that you can work, I think, very well cross-culturally within the IPT framework.
Just one thing to add when Laura was talking about role disputes, I think often an adolescent will tell you that the parent isn't workable. That's sort of their go-to answer. And so just to know that you need to try first rather than to take it at face value. We've had unbelievably difficult parents who we've made very good progress with. And so we don't want to just move to modifying expectations right away, because we don't yet know what can happen in terms of improving the relationship. And I think the best example of that for me was I was training a community clinician and doing IPT-A, and he had a girl who had a group of mean girls in high school, and they were really mean. They were the kind of girls that I didn't really want her to be friends with. That didn't seem like a great goal. But she also had an alcoholic father, and her father and mom were separated, and Dad would do some really awful and embarrassing and unsafe things, like show up and take her for visitations when he was drinking and do other things like that. And the clinician, I think, feeling really overwhelmed at the prospect of being able to change anything about the relationship with Dad, was quick to want to formulate her as being somebody who had interpersonal deficits and to really focus on the peer issue. And I encouraged him not to do that and to really try to address some of the stuff that was going on with Dad. And again, I think part of that was my feeling that these girls really weren't worth being friends with, no matter what she could do. And so this girl who showed the therapist and me as a supervisor that she absolutely had no deficits was able to plan with the therapist help a communication with her father about sort of what their relationship needed to look like for her to feel comfortable having visitation rights, and to really communicate to him what it felt like when he put her in unsafe situations, and to set the boundaries for what those visitation rights look like, so that I want to see you and I want to have a relationship with you, but it needs to be at my house. We can't be in the car. I will not have overnight visits with you until I feel like you can keep me safe. And he really heard her. Did it change his substance using? Not necessarily, but she had this experience of this real empowering experience of having her voice be heard and communicating in a way that many of us would not be able to do in sort of the same circumstances. And it didn't change him. He did show up at her school drunk for a show that she was putting on, but it didn't have the same impact. When he did that, she was able to say to him, "Dad, you need to leave, and you need to leave now," and he left. And so it didn't have the same consequences that it had before. And so I think you really can lead to change. And so you want to push through the hard things. And you want to try it. And the answer is that even if it fails, it's not going to fail any more than their typical conversations fail at home too. And then that becomes more information for you to say, okay, well, that didn't work. We need to try something else. Or then we need to sort of revise the expectations. Because I think too often we have these clients come in and their situations, it's not just that the adolescent is lying, it's truly an awful situation, but we can exert change in awful situations. And I think because she saw that she could do that with her dad, she could then stand up when the girls were being mean. And she sort of realized, you know what, that's not that important. There are other people who I can be around. And it would have been a real error to sort of assume that she needed social skills training, because she was, in fact, a really excellent communicator when she had a chance to work on it.
And another case where you have to, I think the important lesson for therapists is to hold out hope. I had another very difficult mother-daughter dyad where the mother had a lot of psychiatric problems, was a lot of medications. She refused to even tell us what she was on. She and the daughter had a tremendous amount of conflict and really couldn't talk about anything with each other without getting into huge fights. I met with the mom alone to sort of do some psychoeducation about what I was going to be trying to do in treatment with the daughter, and sort of talked about how, and her daughter had made a suicide attempt. This is for a different protocol. And so I really wanted to impress upon the mother the need to sort of make a shift in how things were going between the two of them in order for this child to get better. And I remember the mother basically said to me, I don't think you can change me. I'm not going to change. You can work with my daughter, but I know myself, I'm not going to change. And I said to her at that point, I said, you know what, you may be right. You may not be able to change, and I'm not looking to change who you are. But what I may want to throw out to you is that maybe you can just speak to her in a slightly different way that will still have a big impact on your relationship. And she didn't say anything, and she failed to come in for a number of sessions. But when she finally came back in, one of the things that she said to me was, I observed the work that you were doing with my daughter, that she would come home and I would see her, and she was really trying to communicate with me differently. And I thought, if you're working so well with my daughter, the least I can do, maybe I could make some changes to sort of make my own contribution, since I see that my daughter's enjoying this work, it's helping her to feel better. And she did. She really made some changes that I never would have expected, and everybody in the clinic thought that this was going to be a no-win situation, and this kid flourished in therapy, and the mother made a lot of changes in her communication, although her first initial response was, you know, it's a no-go for me. I have enough of my own problems, and I don't believe in your therapy stuff. So never underestimate what an adolescent trying to do things a little bit differently, the impact it can have on the system. And the other caveat that I always like to remind therapists, especially when you have parents who have a problematic relationship or separate or divorce, never take mom's word for it that dad won't come in. Try it yourself. There are often times that if you as the therapist call and invite dad in, he will actually come in, and that's mom's ambivalence about bringing him in, whether that will change the way the therapist is going to view her and what's gone on in their relationship. So some of our dads will actually come in happily and participate if contacted. So be careful not to accept that on face value as well.